So going to be talking about intimacy with an ostomy to all of you tonight. Now, this is normally a very difficult subject, but let's get started. The old saying is true. The way you see yourself influences the way others see you. And I think I want to read that again. The way you see yourself influences the way others see you. And that's very important to remember. So take time after ostomy surgery to acknowledge the changes your body has been through. Check in with your emotions about how you feel post surgery and share your feelings with your partner. You will find that acceptance of your body after surgery will make all the difference. An important thing that I am starting off with that I really want you to remember, even if you don't remember anything else, is that we fall in love with another person's soul. Without it, the body is just an empty vessel. And there's that old saying that say beauty is only skin deep and it perishes. But the souls that love, they will remain forever. And that is something I need you to remember. So, in terms of intimacy, as a stoma nurse, I feel that it is very important, pivotal in the acceptance process of the stoma and also of your body image to have pre-operative counseling where you can ask all the questions in the world, but I really try and get the partner involved and have the partner present at these counseling sessions because it is important to establish what the intimate life is like before and to tell them that if there are any problems that they should be addressing it before the surgery because would not have gone away after the surgery. It will still be there. Then, depending on the type of surgery that you are counseling the patient for as a stoma sister, we normally know whether there is going to be work done close to any of the nerves or whether there would be potential intimacy issues so that we can set realistic expectations post operatively and open the door to discuss it when they come and see us in our clinics again afterwards because post-operatively they're so busy adjusting and coping and learning their new skills and it's such a lot to deal with that sex is normally on the back burner. So I make a point of it that when I see them in the clinic after they've been at home for a while, that I actually bring up the topic and talk to the patients about it so that I can open the door for these discussions because it's not something they will come up with by themselves. And I often find that they go home and the husband and the wife will sleep in separate beds because they're scared that they will hurt each other. And if you don't talk about it, nothing will happen and the relationships will just, you know, go south. So I want to tell you that in terms of intimacy, there's only one rule. Never use the stoma for intercourse under any circumstances. You and your partners should never use the stoma for penetration either, any kind of penetration. Transition back to your sexual activities is something that I think people, especially men, they think about it before the surgery. So resuming it after surgery can be an emotional and challenging time for both you and your partner. And in most cases, I have found that the ostomate will be coping with the effects of the surgery and the recovery. They're adapting to the new skills that they've learned to cope and take control back of their own bowel habits or urinating habits. And then there's the changes to self perception. Um, and it really makes them feel very insecure uh, it goes from being naked to being dressed, and not knowing how to hide or what to do with noise. Then, on the other hand, the partner may be worried about causing discomfort during intercourse, or even worry about the ostomate's reaction to the pouch and the stoma during intercourse. So those are all issues that you as a couple need to talk about when you are starting to think about going back to sexual activities. It's important to discuss feelings and responses to the changes that have occurred to both of you, because although one person has had the surgery, the other one has seen the ostomate go through it and it affected that person as well. There will undoubtedly be fears about feeling sexy, about being able to stimulate each other visually, sexually, and about being able to respond. But the more you stress about these things, the less they will happen naturally. So, if you haven't seen your partner's pouch or stoma, it is probably because you were not available or present during the pre counseling and discharge counseling and teaching sessions. Um, so, I would advise that you consider exploring the pouch and the stoma together before engaging in any sexual activity. It's important for the partner to understand that the stoma doesn't have any nerve endings and will not be hurt, and encourage your partner to actually touch it and tell them that you can't feel it, so they won't be hurting you if they do touch it during any activities. And then start off slowly. Think about having a shower or a bath together and using that time as a safe opportunity to start touching and caressing each other again. And then things will just progress from there naturally. It's also important to find room for humor, because the stoma will make unexpected noises, and sometimes it might feel or sound like there's three of you in the room. So be prepared for that. Try to avoid timelines and specific expectations about resuming sexual activity. Explore alternative ways to be intimate and do not expect penetration the first time, so that you don't set yourself up for failure. And talk to your partner about taking it slow. In general, we normally advise that you wait about 3 weeks after surgery before initiating sexual activity. But again, it depends on the type of surgery that was done and how big the surgery actually was. So, if we look at some tips, I must say that I have found in all the years that some spontaneity may be lost, particularly in the beginning, as they learn to manage the pouch and stoma during sexual activities. But with a little planning, they can make it a special time and less worrisome for the both of them. Please empty the pouch before your time together and consider securing the pouch in some way to prevent it from moving or flapping during intercourse. Like use some tape across the pouch onto the abdomen just to secure it, or maybe use a concealment device such as a cummerbund or crotchless underwear for the ladies. Weight on the stoma will not harm it, but friction can cause bleeding. So it's important that your partner understands that and does not go into a frenzied panic when there is a little bit of bleeding. So try different positions and discuss and explore together. Try smaller, more discreet pouches, such as a closed end pouch or a stoma cap. And there's also stoma caps available for the two-piece systems. Just speak to your stoma nurse about it, and they will give you and show you all the options. Don't keep quiet. If resuming sexual activity remains a challenge for you both, you may benefit from the expertise of a sexual counselor. Ask your surgeon or stoma nurse to provide you with options and a referral to a professional who can help to guide you and your partner back to a fulfilling sexual relationship. A sexual therapist that I have worked with previously have the saying that in any marriage or relationship, if there's a problem in the bedroom, it is 90% of the problem of in the relationship. If there's a problem in the relationship and there's no problem in the bedroom, they can overcome anything. So don't let this become the end of your marriage or your relationship. It is something that you can overcome together. So there are many options for both of you out there. Please don't keep quiet. Speak to your stoma nurse about it. So when it comes to single people, there's always this big question when to tell. Tonight, I want to say to you, your stoma does not define who you are or what you can do. You are not the ostomy. You have an ostomy. It saved your life, and your life has meaning. You add value. It's completely up to you when to tell a new romantic partner about your ostomy. So you may want to take some time to figure out what you want to say before you say it. And it's okay to keep it short and basic and then decide if you want to take some questions afterwards. I think it's important to remember that most people are just curious and most people are willing to learn. Now, in terms of different schools of thought, in my practice, I have come across people that would immediately, if they start in a relationship, tell their partners. And then they feel that if they are going to be rejected, then it's in the beginning stages and it's not going to break their hearts later on. But these are people that are so confident that they have the attitude of take me as I is or leave me, but I am definitely not changing for you. This is me, this is all of me, take it or leave it. Then you have the people that are a little bit more reserved and they feel that they will only tell when the relationship moves towards the part where you have to get naked. So with the clothes on, you are able to hide your ostomy and you don't have to tell anyone about it unless it's your choice. But if you then want to start, just to give you an example, it's important to discuss with your partner before you actually get naked. And you can say that you've had some disease, which you've had, because you've all got different stories. You had to go for major life saving surgery, and it left you with a pouch. And then start answering questions. It's just an idea that I'm leaving with you about how to approach it. Um, so I want to say to you that you are very special to someone out there. Never change yourself or dim yourself for someone else's comfort. Of course, be willing to change and compromise slightly because it's a big part of relationships, but never lose sight of who you are. The right person will love and embrace you and help you to celebrate who you are. People who are meant for you won't mind about your ostomy, and people who mind your ostomy honestly don't matter and don't deserve to be in your life, in your heart, or in your headspace. So live life to the fullest because you can. And thank you.